Hey everybody, it's Dr. Eric Balcouch. We're back for another edition of Thyroid Thursday, and today we're answering a question that I'm sure a lot of people have. I get this question a lot, and that is, can the thyroid gland recover? If you're a person who's prescribed thyroid medication, are you going to need it forever? And the answer is, I don't know, maybe. But what I can tell you is that the vast majority of people who are on thyroid medication are probably not going to recover their thyroid gland because they're taking a level of thyroid hormone replacement that is suppressing thyroid gland function, and therefore it may potentially lead to atrophy of the gland. And so in that situation, if you're taking a day's worth of thyroid hormone replacement, the thyroid gland doesn't need to work, and it's going to start to probably reduce its ability to recover in time. However, I see people all the time reduce the need for thyroid medication, and many people are able to eliminate it altogether, and I'll go through a case today. But what's really important here, and why I think we have to take a better look at what's going on, and why I'm so outspoken about thyroid medication, especially what we're doing in functional medicine, is because the vast majority of people who are on thyroid medication are believed to be on it inappropriately, okay? There was a 2018 meta-analysis that came out, and based on that report, the authors of that report said 60% of the people on thyroid hormone replacement therapy were treated when they had subclinical hypothyroidism, meaning their TSH was elevated, but their free T4 was normal. So that it appears that they had enough T4 in the system, and they had signs and symptoms of hypothyroidism, so they were put on thyroid medication, and probably inappropriately. So somebody might say, but I was symptomatic. I had signs and symptoms. I felt better initially when I went on it. Right, but why was TSH elevated? Maybe TSH was elevated because T4 was normal, but there was reduced conversion of T4 to T3 at the tissue level. So there was reduced circulating total T3, reduced free T3, and the person was symptomatic. Because remember, what causes hypothyroid signs and symptoms is decreased T3 on the receptors inside the cell. It's not about necessarily how much thyroid hormone's in the bloodstream. It's about how much T3 is binding to receptors in the cell that causes the symptoms. So they also said in that paper that 30% of the people who were on thyroid medication were put on thyroid medication when they had normal levels of TSH and potentially T4. So somewhere between 60 and 90% of the people on thyroid medication were probably inappropriately put on thyroid medication. And I know, before you go crazy saying, hey, I had signs and symptoms, I felt better when I took it, I agree that you might have had signs and symptoms. But the argument, and you might even say that I felt better taking it. I agree, you might feel better. But the argument is, at what point do we intervene? And does the intervention of more thyroid hormone into a system that my argument is may not want it, is that helpful, or is it potentially problematic? And I've made the argument on podcasts, in my book, on a lot of these posts, that it may actually be more problematic than beneficial. But I do not argue that you have signs and symptoms. And my discussion all the time is, you may have a gland that's making enough thyroid hormone, but you're having hypothyroid signs and symptoms, not because there isn't sufficient T4 being made by the thyroid gland, but because the cells that convert T4 to T3 are not doing it for a reason. Now, some people in the functional medicine community may say, well, your body forgot how to do it, that we need to fix the T3 level because the body's just not able to do it. I don't believe that to be the case. I think it's more of an adaptive response in most people. Cells operate one of two modes. They're either in low stress mode, what we call homeostasis, or they're in high stress mode, we call that allostasis. And when cells are in an allostatic regulation mode due to some type of excessive cell stress, there's a natural decreased conversion of T4 to T3. And there's other things that can cause a natural decreased level of T4 to T3, and there's an elevation of TSH oftentimes as a result of that. And you might feel hypothyroid, but it doesn't mean we need to always jump in and intervene. Maybe the more important thing is to figure out what's causing this tissue hypothyroidism. I believe that the body doesn't make a lot of mistakes, that tissue hypothyroidism that's causing your signs and symptoms is the result of some type of threat response, some type of infection, toxicity, inflammatory cell stress process that's going on. And the cells are adaptively decreasing the conversion of T4 to T3. It's not broken physiology. So putting more thyroid hormone into the system can temporarily make somebody feel better, but in the long run, it actually becomes the problem. And it becomes a huge problem in causing the thyroid gland's function to really be potentially lost in time. So here's a case review. It's a patient who came to me in 2023. She had signs and symptoms of hypothyroidism. She also had signs and symptoms of over-medication. So signs of anxiety, depression, irritability, weight gain, constipation, loose stools, lots of symptoms. She was on 100 micrograms of T4, 5 micrograms of T3. So essentially what the doctor was doing was replacing what her thyroid gland would have made. Now, she didn't feel good. Maybe initially she felt better with some thyroid hormone, but eventually over time, the dose kept going up and up. So this spring in 2024, we take a look at her. She has 75% improvement of her symptoms in a year, and she is no longer on thyroid hormone replacement therapy. How did we do it? Well, how do we do it? We take a look. When I meet with a new client, what my primary goal is to get them on what I believe is a more appropriate dose. I don't prescribe medication, so I explain to them what I see in the labs and potentially explain that to them so they can explain it to the physician, or I help explain it to the physician, and we can get the doses changed. We monitor those dose changes, and while we're monitoring the dose changes, we're trying to identify the stressors that are creating that excessive cell stress response. Is it toxins? Is it organisms? Is it hypoxia? Is it foods? Is it poor breathing? Is it disrupted sleep? Is it emotional stress? Is it trauma? What is it? And usually it isn't a thing, it's a combination of things. Once we identify stressors, we start eliminating them or reducing them. And as we do that, the body can shift from cell stress response or danger physiology back to more homeostatic regulation. And so what we want to do with supplementation is support the recovery from allostasis to homeostasis, which is not often what we do in functional medicine. We try and manage conditions with supplementation, and people wind up on 10, 20, 30 supplements per day. And then 4, we need to continue to monitor their labs, and not just the TSH and free T4, but we need to monitor a full thyroid panel and say tissue markers of thyroid status so we can determine when it's time to reduce the dose again. And so for this young woman who was on medication for a number of years, she's now feeling better, functioning better, and is no longer on a medication that she may not have ever needed to begin with. All right. Hope this helps. If you have any questions, put the questions below wherever you watch the video. But if you work with a functional practitioner, there's a good chance, if they're actually practicing functional medicine and not trying just to optimize the blood levels of T4 and T3, there's a good chance not only can you feel and function better, not only will the medication you take work better, but there's a good chance that over time, you're going to need less and less medication and maybe not need it at all. All right? Hope this helps. Take care.